Medical Dilemma.
Hi ladies and gentlemen, welcome back to Medical Dilemma. I'm your host, Attorney Sarah Sugitan, and still with us is our guest, Dr. Albert Madrilejo and Dr. Attorney Teresita R. Sanchez. We're still discussing endometriosis, its symptoms na, it's not just pain, it can even be infertility and how is it diagnosed? It can be diagnosed by, ano ba yung sabi niyo, Doc? Yung, not just ultrasound
and
laparoscopy. And pag hindi laparoscopy, do you open up, do you do surgery, Doc, to determine if a patient has
everything
endometriosis?
fails and the patient really is desirous of,
To find
to
out.
have an operation because wala na eh, last resort na, ba?
Well,
What do you think?
to diagnose it,
To diagnose,
are we
Doc.
talking of laboratories are negative, everything are okay?
Yes.
Yes, everything.
And
Yet symptoms, may
Nag-
symptoms yung
And
pasyente.
if you do a laparoscopy, there's no endometriosis?
Seen.
Yes.
Well, you can do a bite on the peritoneum, several areas, because the endometriosis might be microscopic
It might
or
come
very
out there.
minimal. At the same time, if it comes out that it's still
Negative.
negative,
Negative.
then just stick with painkillers. Now, if it's endometriosis, which is microscopic, usually at the very early stage, you can just see hemosiderin pigments. Those are small
Scar tissues.
blood cells, something like that, or
Blood
scar tissues. That's enough to label the patient as having minimal endometriosis. That's stage 1. And usually you can opt the second in going to treatment, a patient with chronic pelvic pain or it has been there for more than 6 months, you give these menopause drugs.
which we were discussing.
Leuprolin, gonadotropin releasing hormone. And like what Dr. has mentioned, if these things can really happen also in adenomyosis, they don't want an operation, give also this menopause drug so that they shrink in a little while, or don't let the patient menstruate. Now, the other thing is when you do operate, I think we have to expound on that because there are several who would remove the ovary because, on stage 3 or 4, you can have 1 or 2 ovaries which are involved by endometriosis, and usually they measure 3 centimeters to 6 centimeters to 8 centimeters every time, and there's so much pain. So, when you open up, you do not remove the ovaries. Why?
Kung premenopausal, reproductive.
Reproductive,
Yes.
and they're desirous of
Having
children.
More
Why?
children.
Because a patient who has endometriotic cyst already, the ovarian reserve or the ovarian eggs are already minimized or compromised. Why?
Compromised.
Here is the ovary. Endometriosis drops there, the blood, islands, menstruate, expands, and press on the tissue. Becomes big as 6 cm. So, some of the follicles or eggs are already what you call compromised or destroyed. So, what if you remove one ovary? So, you're left with the other ovary.
With only one, no?
But the problem is, I mentioned earlier, in 1 year, 10%. In 2 years, 20 to 30%.
Yeah, it will come back.
It comes back. Or what now? You have only one ovary, it comes back.
Oh, nga, Doc. I mean, as you said, this can occur in women as young as even 13 years old, 20 years old, and at that time, if you're still single and you need to compromise
Correct.
taking everything out by surgery, and hindi ka na magkakaanak if you take everything out by
So
surgery.
like this, if it's surgical, I remove on a 20-year-old, as young as 17 and 18, I have patients. I
with
remove
endometriosis?
just the
The
cyst.
cyst.
Just
Ah,
the
okay.
Just the
cyst.
cyst.
Then dry up the other islands of endometriosis which are scattered with gonadotropin releasing hormone for 6 months. And then, okay, no menstruation till you meet or a guy or till you get married and want to have a family. Why? Because if menstruation comes back, then
Might
So
worsen
will,
the
it
condition.
comes back,
yeah.
everything
Yeah.
comes back in a worse or more difficult scenario.
So in that case, Doc, when you feed them that, you make the patient menopausic, kasi sabi mo, so 3 months wala yung
3 months to 6
menstruation, or
months,
to
yeah.
6 months.
Pwede
just
naman
to
yun
prevent
eh.
the,
And when the menses come already, then you put them like family planning, birth control injection of progesterone. So
encourage
no menstruation for the next
reproduction.
5 years, 10 years, and it's a very safe drug. Of course, there would be complications, always. And no menstruation, so they can wait for the right guy to come along or to have a family.
It seems to me, Doctora, that the medical dilemma here is, if I am, for example, a patient afflicted with endometriosis and I am in my reproductive years, and usually patients think na the solution is to tanggalin yung matres, tanggalin lahat, or do everything by surgery if hindi na matreat medically or by other drugs. So you are left with, do I take my reproductive system out, or do I retain it with the risk that endometriosis will still recur 1 year or 2 years?
That's why, as I said, as Dr. Albert had said, it is really individualized. Not the
It's
treatment is
individualized.
individualized. It depends what you really want. But when you are in the reproductive stage, it's better not to be too aggressive, right?
Correct.
Because you want a baby.
So if the priority of the patient is to have a baby, then you don't
You try
opt
to
for,
preserve
you
everything
preserve
first.
everything. So you may remove those tissues by surgery, but not everything, hindi ovary, the
yeah.
uterus and everything.
Yes.
Like
But
what
Dr.
others do.
Albert, if they have endometriosis, what do? You just remove it because there's a tendency for it to what? May pwede ba mag-emergency rin yan?
Well, we do find endometriosis cysts on the ovary to rupture. They do rupture. At 6 cm or 5
Emergency,
cm,
because-
when they move, when they go to the gym, stretching, scar tissue, adhesions,
Yeah.
they can suddenly rupture, and it's a medical, surgical emergency. They go straight to the emergency room.
There be
operating
bleeding,
room.
right?
Yes.
Bleeding and
It
pain.
doesn't always close by itself, especially if it is a warak, rupture na
Oo,
malaki.
6 centimeters, really have
Yes,
to,
because very fragile yung cyst na yun eh. Very fragile.
unlike yung normally what I hear, yung mga myoma, this is, although there is also a kind of myoma that is concomitantly, that the endometriosis will lead to.
Adenomyoma
Ayun.
would be related with endometriosis. That's the severe case. Or there would be myoma. So some patients would say, Doc, I have a myoma. Why not remove my uterus? They have 1 kid or 2 kids.
Yan.
Okay, you remove the uterus, and then there's endometriosis or none. Then you find out, wow, there's endometriosis all over the abdomen at age 42, 43, 44. But the patient wants you to remove the uterus because there's a myoma, a big
remove
myoma.
everything.
You remove the myoma
Myoma.
and the uterus. Now, the question, the dilemma, will you leave the ovaries or not?
Yes,
If
because
you leave the ovaries, they found out that if you leave the ovaries, then still there is estrogen
oh yeah,
from the growing eggs, follicles. Yes, estrogen is nice for the woman till age 50. But you see endometriosis, no more uterus. Are you going to leave the ovaries? If you leave the
Because-
ovaries, they find in all literature, the risk of having a reoperation is 8 times more in the coming years.
Because in endometriosis, they implant also elsewhere,
They
even in the
implant.
skin, right?
Correct.
And so when you leave your ovaries behind, it's being nurtured yet by the estrogen from the ovaries. And so you can still have complications despite these simple
And these are what you call, the theory here is the hematogenous or lymphatic spread. Or sometimes mechanical spread. During a cesarean section, there might some endometrial lining that would find its way on the scar or umbilicus. So every time the patient would menstruate, there would be bluish discoloration. In a normal
and
delivery,
pain. Oh.
sometimes you'll have endometriosis also on the vulva or on the, because
It's,
it migrates by
migrates,
hematogenous or lymphatic spread.
ganun po pala, no? So, but as you said, no, it's a judgment call by the patient and also the doctor. As much as possible, you try to preserve everything instead of being aggressive, as you said, Doctora, no, which means tanggalin na lang lahat yan para wala na akong endometriosis, wala na akong myoma. But that's not always the favorable result.
And it's not always an assurance that just because you remove the uterus or even leave the ovary behind, or even though if you remove the ovaries behind it, you will not have a recurrence,
no longer
right?
have a recurrence. Okay,
Yes.
Dr. Tess, Dr. Albert, we've come to the top of the hour, so I'd like to ask you to give a parting shot to our viewers about this really strange disease that probably afflicts a lot of Filipino women who do not even know that they have this disease. Dr. Madrilejo.
Well, a good parting word would be, number one, you have to make sure that if you have dysmenorrhea, pain on sexual activity, infertility, with a family history, closest of sibling, there's an occurrence of 10%, please see your doctor. Have a conservative surgery if you're on your reproductive years. Very conservative. You leave the ovaries, you don't touch them, maybe remove the cyst, then treat medically, get out, and make a baby right away. Or be aggressive that the patient does not menstruate, so that when the time comes that she wants to have a family of her own, it would be easy to cure her. That would be for a good advice, I think.
Thank you, Dr.
Sarah.
Madrilejo. Dr. Sanchez, any last words for our
As mentioned
viewers?
earlier by Dr. Albert, we do not know exactly the cause of endometriosis, but one of them is reflux or regurgitation of the blood to an outside space, no? Because the fallopian tubes are there and they're open, so it can be. Now, it's just my personal opinion. There are no documented cases, but I would advise the women during their menstrual period not to be too aggressive or too active. You know, some they continue somersaulting, biking, all those strenuous activities. But it doesn't mean that you have to stay in bed either, no. But just take care, because that could be a possible cause of reflux.
Okay, thank you very much, Dr. Sanchez and Dr. Madrilejo, for joining us today. I hope you learned a lot about endometriosis, and if you think that you are in danger or you fear that you are suffering from this disease, please contact us here, Medical Dilemma, through heavenlycrestproductions@gmail.com, or approach your nearest OBGYN. Thank you for joining us today. I'm your host, Attorney Sarah Sugitan. Join us again next week for another episode of Medical Dilemma.
So nice.
Doctor,
Medical Dilemma